Welcome to CareTalk, America's home for incisive debate about healthcare, business, and politics. I'm John Driscoll, the chair of the Yukon Health System, and today we have Gaurang Choksi from Violet Health. Gaurang, welcome.
Thanks for having me, John. I'm excited for our conversation.
Well, first question is, why call it Violet?
It's a very personal mission for the work we're doing. Lesbians in the 1800s used to wear violets to really denote their sexual orientation. And I'll share a lot more about why I started the company. But as a gay man, really having access to quality care that's trustworthy has always been near and dear to my heart. So we chose Violet because it really represented our mission well.
And so how big a challenge is it for folks who are, not from a traditional sexual orientation to necessarily access the healthcare they need, the advice they need? How big a problem are you trying to solve?
It's massive. John, the reality is our healthcare system wasn't really made for humans. Every single patient, all of us, we're all people, we're all humans. Our healthcare system just isn't serving us. And I'm preaching to the choir here. But I personally built a health plan for many years called Oscar. And one of the things that I saw building Oscar was people would always call in and say they want a doctor that's like them. Whether it's a new mom or an expecting mom saying, hey, I want to work with a provider that actually shares my identities, or whether it's a person of color, a veteran, a gay man like myself, people look for people that really understand them. And the reality is our healthcare system wasn't actually created to help people find trustworthy care as soon as possible.
I couldn't agree with you more. I think in many cases our healthcare system was designed to make contact and generate a bill. It's frustrating, and yet there's so many good, caring people in the middle of it. But maybe to tell me a little bit more about your origin story. Where did you grow up? How did you get to Oscar? I love the Oscar team, the Oscar health, the revolutionary digital first healthcare team that Mario and Josh and others kind of built up. But how did you? What you weren't born there. Where'd you grow up, and how'd you get to Oscar?
Yeah, it's a great story, or at least I like to think it is. But I myself grew up in India. So my whole family actually moved to the US in 2001. And I've always been really mission driven. When I first moved to the US, my family and I all grew up on Medicaid. So literally both my parents gave up their professions. We restarted life. We had access to Medicaid. And I got to see firsthand as a teenager just how difficult it was navigating the healthcare system as non-English speaking immigrants. And then more so just being a gay man, as I actually came out to myself and my peers, what I saw was how challenging it was finding doctors that were actually affirming. In the simplest words, I wanted to find doctors that could actually advocate for me. And it was so difficult to find. And so I had just graduated college, and I thought I was going to start an insurance company similar to what Mario and team did.
Why would you ever start having been an insurance executive? You should have called more of us who've tried to innovate within, the old empire.
Yeah, well, I got to learn firsthand. So I joined Oscar in the first 100 employees, and by the time I left, they had 1,500 people. I'm really proud to call Mario, Oscar's co-founder, one of our investors. But what I loved about building Oscar from scratch was we did everything. We rebuilt everything. And so I always say healthcare is death by 1,000 paper cuts. And a lot of my peers from Oscar, we chose paper cuts that were personal to us to really fix. And for me, that was personalized healthcare. How do we really help everyone get the care that we need in networks you have access to?
And so you at Oscar, what were you doing? Because Oscar really was an attempt to, rebuild an insurance business, a health insurance business, truthfully, that was much more focused on deep personalization and digital first, digital forever engagement, so you could measure and monitor everything. It was initially obviously built around the Affordable Care Act subsidies and the expansion of the market. But I think the novelty was the extraordinary technical stack that was built up around it. And, now it's I think thriving. It took some time, but where did you work there and what did you do?
I held a few different roles. So when I started my career at Oscar, I was specifically in technical operations. So essentially product and operations and really thinking through what is the tech stack that they actually had. And it was a really amazing journey because they rebuilt everything from scratch. Their claims, I believe right now the number is 98 or 99%. Their claims are auto adjudicated end to end, which is amazing. But after working in operations and product, I spent a few months in the marketing team and then specifically the insurance design team or insurance product design.
And so then what kind of provoked you to start Violet? You know, one of the things, the backstories here is that many of our listeners may not realize is I think that Oscar has spawned 20 or 30 startups from folks who are graduates from Oscar. Oscar had a long, slow journey to public market success, but is succeeding quite nicely right now. But through that period, drew a lot of innovators like yourself into the company that have now are starting digital businesses that'll hopefully help us get to a better healthcare system faster. But what was the trigger that made you decide, okay, I'm going to leave the mothership and start your own company?
It was honestly seeing all of the customer and just feedback we were getting from our concierge teams. So outside of my day-to-day jobs at Oscar, one of the things that I'm really proud of was I led their LGBT affinity group. And John, it was fascinating. Leading the LGBT affinity group at a health insurance company, what we got to see was lots and lots of data of what were our LGBT members actually saying. And what we heard over and over again was people were calling in and saying, I don't feel safe with my doctor. I want a doctor that looks like me or shares my identities. Of course, the challenge becomes in our country, we don't have that data. But even if we did, there aren't enough diverse doctors. And what we wanted was
In every element of diversity. It's a very sadly much of the healthcare system looks like me, talks like me, acts like me. It's the nature of a system that grows slowly and is calcified a bit because of the you know the structure of the way we make doctors and the limits we put on immigration. Um, so you're hearing that feedback, and but it's a pretty big step to then go
yeah,
out and start your own company. Other than providing an environment where people could be seen and connected in a way through people like them, however defined. What else motivated you to jump and start your own company?
growing up in a small village in India and then moving to the US gave me a very unique perspective. And I like to think, and maybe this is projecting, a lot of immigrants share this perspective, which is I've already made it. The fact that I get to be in America, to me, that's such a huge privilege. And I already feel like I've already made my wildest dreams come true. And so building a company just felt like the right thing to do, specifically when it's doing something that I deeply believe in, which is ultimately helping people find trustworthy care.
And my grandparents are immigrants, and so I definitely identify like you don't when you realize how far that your family has come, the distance to go, the risks associated with entrepreneurship look a lot less daunting because of the distance you've already run, and it's must be even much greater coming from a small village in India. So when did you start Violet, and what was the sort of the founding theme?
Yeah. In 2020, literally 2 months before COVID, in hindsight, maybe not the best timing, but
But you couldn't have really predicted it. The timing wasn't great, but if you could have predicted that, you would have had put one heck of a long put trade on.
exactly. No, but I feel very lucky. We've had some amazing colleagues, a few team members that came from Oscar as well. But in 2020, we started the company and really the idea was one core idea, which is if we credential or verify providers that are doing phenomenal with many different communities, we can then build systems that really align incentives. And what I mean by that is if you know what doctors are doing really well working with Black or brown patients or LGBT patients or veterans, you could use the data to both build better relationships, but do savvy things like pay those doctors more or make sure a network is actually the right network for the people it's there to serve.
And how do you measure that, Gaurang, in a way that doesn't create a new set of biases? It's an interesting that every set of preferences has embedded in it a potential bias or misdirection, unintentional, or it could be in a direction that you do intend.
Yeah. My team and I spent a lot of time thinking about this. The reality is, as a startup, we're going to an industry that represents 20% of our country's GDP and saying, trust us. And what we work hard to do is earn the trust, not just of every provider we work with, but earn the trust of payers, of policymakers, and ultimately patients. And so the way our technology works is we really think of ourselves almost like a credit agency, but for cultural competence. And so every provider has a profile, and in there, we collate lots and lots of data and we show them. So we actually show them with claims data that we know that 80% of their patient panel may be gay men. Or we know that, hey, 92% of their patients are actually Black or brown or belong to the Asian community. And this is all insights that they really appreciate, but the providers are the ones in the driver's seat. And so the providers can go in and do more trainings. They could go in and actually say they've already built other expertise, maybe because of volunteer work or other educational work. But ultimately, we're doing a deep dive in their experiences, which allow us to then actually structurally show what communities they're doing phenomenally well with. And then to really validate our work, what we ultimately look at is, are people getting better faster? And so we have the privilege of working with leaders like United Healthcare, like Elevance. And what we specifically are doing is building business cases showing that when patients are given an option to choose a provider, trustworthy, the patient is not just going to preventive care faster, they're actually getting better faster. And so that's what we get really excited about.
And how effective has it been?
It's been really amazing. So a lot of our early research came through direct relationships with partners like One Medical or Eden Health. And the beauty of starting with digital health partners is they were very, very collaborative and very transparent. And so with Eden Health, for example,
they can actually get access to the data in a structured, clean way.
Exactly. And so with Eden Health, our huge focus was on looking at for the providers that earned a Violet badge and completed our educational collections. Did they actually deliver higher quality care? And what we saw was the providers that did our program, which was more than 85% of their provider base, they not only were actually able to attract the clients they wanted to attract, we saw that they were able to get hypertension and diabetes more in control in their patient panels.
Wow.
And
I mean, those are, I mean, just to be clear, those are the two of the most important pervasive categories of chronic illness.
Absolutely. And I don't mean to be reductive, but really what we think a lot about is we've created systems of positive reinforcement. We're not saying every provider has to be an expert with every community. What we're saying is providers just know some communities better or worse than others. And it's okay. Let's recognize that. Let's then educate and upskill according to that. And then ultimately, by recognizing it to patients, we're helping people build better relationships, and those relationships translate to better communication and better outcomes.
But really what you're building is a reference set of tests regarding the ability to influence care that test whether in how the doctor or clinician sees and makes the patient feel seen in a warmer, connected, more comfortable way can directly result in better care and better influence on how the patient cares for themselves. Is that basically the right way to think about it?
Absolutely. I'll share a brief anecdote. We do a lot of, right now on our platform, we have about 70,000 providers across the country, which is a lot. We do a lot of surveying. And one of the things we hear is 75% of the providers say they're more confident just speaking to identities. Now, as a gay man, I'll throw out a health disparity. Gay men in America have 20 times the rate of colorectal cancer. If my doctor can't say the word gay to me because maybe they feel uncomfortable, maybe they just have never been taught why it's important to even speak to sexual orientation, it's unreasonable to ask that provider to then teach me about health disparities that affect gay men and specifically guide me on what preventive services I need. And so at Violet, what we're really proud of is when we combine clinical education on how to eradicate disparities with just helping people actually understand how to speak to identities, how to say the word Black to a Black man or gay to a gay man. We find that that goes a really long way in helping them grow.
Gosh, it's just that element of being seen. It has that big an impact. That's wild. So
Absolutely.
you're not saying that we need, because I made this argument that we need many more female doctors to take care of females, many more black doctors to take care of black, the folks of color we desperately need that level of growth if we're going to actually care effectively, because you see it in all of um, the unseen obstacles that lead to less access, less care, and actually, frankly, poorer outcomes, even if you hold income and class constant. It's remarkable. But
I
I
think
think what you're saying is there's an unlock in recognizing people as who and what they are, even without necessarily having grown up in or close to their shoes. Is that what you're saying, Ron?
we need both. I think I sincerely believe as a country, we need to acknowledge the reality that our clinical workforce just doesn't represent the country. And that's a systematic failure. And we need to do better. But at the same time, I also think we need to create technology and systems where if a provider, even if they're not LGBT, but if they spent their whole career, let's say working with the LGBT community because they worked at an FQHC or at a community center that catered to the LGBT community, we need to recognize that. And the principle applies to every community. You know, if a provider has spent 2 decades working at the VA or working at a system that was predominantly catering to veterans, to me, that provider deserves recognition because they've already built that skill set in understanding how to serve veterans. So we think about that across all communities and identities.
Interesting. And so then, who pay? What's the business model, Gaurang? Who pays you? How do you
We,
grow?
yeah, we were very intentional about how to align incentives. You know, as a company, I think I shared this earlier, but we're asking the whole industry to trust us. It's everyone from the providers to payers to provider organizations and patients and policymakers in that mix. The way we monetize is we work with health plans and care delivery organizations of all sizes. And essentially they pay a platform fee and then they pay a shared savings for any cost of care improvement.
That you've got to really believe you're going to drive shared savings if you're going to make your bottom line grow.
We do, but John, I'll share something. A lot of our growth has specifically come through the Medicaid line of business because what we're seeing is whether it's a blue state or a red state, everyone cares about cost containment and population health. HMA just put out this great state of state summary report highlighting what governors are talking about. Every single governor out there right now is worried about maternal health equity. They may not use the words health equity, but we can see from a population health perspective, every single person is talking about maternal health outcomes.
Yeah, no, they've gone from talking about equity to quality, and I'm okay as long as we make some damn progress. But we've been
Yeah,
we've been going the wrong direction for a while. I'd like equity, but more importantly, we absolutely have to have better outcomes. And so, who would buy your stuff? I mean, so it's health systems, health plans, and then how does it work?
a great question. It's predominantly health plans, and then a lot of regional or care delivery organizations will join us because they learn about us, they love the approach. Essentially, a health plan brings us in, and then they'll offer us to their whole network. And so immediately what we give to the health plan is real-time analytics where they could actually see if they're across Colorado, county by county, what are the counties where there's communities that just can't get access to quality care. And then what we do is we turn around and the whole network gets access to the Violet platform, both for earning the badges or the verification, but also for clinical education. And what's been really amazing is in some markets, the health plans even pay the facilities more if they become verified. And so this is with United Healthcare, they were the first ones to roll this out. But we're really excited because it aligns incentives across the board.
And they would do the United Health Plan, which comes in for obviously a lot of criticism because of the nature of what they do, is putting you in place because they want to do what?
They want to improve health outcomes. Ultimately, every
Okay,
single
I really wanted to underscore that this is an investment by United Health Group in finding a different angle to identify how to improve health outcomes, which is quite thoughtful of them.
I couldn't agree more. I keep going back to this concept of trust, but really what we're asking for is a lot. We're asking providers to trust us in our verification. We're asking payers and health plans to trust us that we could improve outcomes. We're asking the facilities that the providers work for their providers' time. And ultimately, to every listener, we're asking every single patient to trust a violet badge. It's a lot. And so my team and I spend a lot of time making sure that we're doing the upfront homework and legwork to really make sure we rightfully earn that trust through and through.
So is there just, I guess, one final question, Gaurang? Is there anything about Violet that you'd want people to know who had already heard about you but weren't quite sure how you fit in the healthcare system?
Like every founder, book a call with us, get to know us. I'm a big believer in long-term relationships, whether it's with investors or customers or employees. And really, so much of life is just working with people that you deeply value. And so if you've heard about us before and you're interested in learning more, go to our website, book a call. We're excited to get to know you and to share more about our work.
Gaurang, thanks so much. And that's it for another episode of CareTalk. If you liked what you heard or you didn't, we'd love you to subscribe on your favorite website.